You're about to experience Healthline, a show where doctors from 𝗛𝗶𝗵𝗶 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗛𝗶𝗵𝗶. Hello to those joining us from Honolulu, Dubai, and Madrid. Is it hot where you are? Because here in Metro Manila, in the Philippines, it is hot outside. Yes, I just came from outside and my hair just gave up. But anyway, it's hot out there, and it's kind of, how would I say this? It's kind of fitting that we're talking about burns today. Now, of course, burns are a serious subject. And with us today is Dr. 𝗠𝗸𝗁𝗃𝗓, or I guess we could call him Dr. Mike. Of course, Dr. Mike 𝗂𝗁𝗃 practices in 𝗛𝗏𝗵 in the prestigious Makati Medical Center, and he is a plastic surgeon. That's his specialty. And, you know, I just want to say that plastic surgery, when people first think of plastic surgery, they think, you know, it's to beautify or to augment or take out whatever it is. But there is a very important function that plastic surgeons do. And we're going to learn about one of those functions today. And that is that they treat burn victims. Okay. And they are the experts. They are the specialists. When it comes to burn victims, you wouldn't automatically think it's a plastic surgeon, but it is. It's plastic surgery because they know about all the tissues and all the stuff that goes with treating burns, especially the most serious burns. So welcome to the show, Dr. 𝗠𝗸𝗁𝗃𝗓. May I call you Dr. 𝗂𝗁𝗃?
Yes, please. Good afternoon.
Good afternoon. Thank you for being a guest on the show today. And thank you for helping us stay informed about burns, no? And can I ask you, doctor, okay, let's start it off. What are the most common causes of burns?
Okay, so there are many types of burns.
Okay.
The most common is the scald burn, or the burns brought about by hot liquids.
Okay.
And then the second most common are the flame burns.
Mm-hmm.
It comes about with direct contact with fire. And then there's also contact burns, electrical burns, chemical burns. Yeah, those are the different types of burns. But the most common is the scald burn, followed by flame burns.
Okay. So when you talk about scald burns, doctor, that's when you, like, you know, you take it for granted, or an accident happens. It's like you're heating water or maybe even coffee and you spill it on yourself or on someone else. That would be a scald burn. Okay.
Yes.
And then you mentioned fire burns, so that would be direct contact with fire, like
direct contact with fire, most commonly when your clothes catch fire.
Okay.
Yeah.
Okay, when your clothes catch fire, yes, and then we do the stop, drop, and roll. But sometimes, you know, it's not enough. Maybe you can tell us about stop, drop, and roll later when we talk about, you know, how to avoid or treatment of burns when it comes to first aid. You said there are chemical burns also. Of course, can you tell us a little bit more about chemical burns? Like, give us an example.
Okay, there are two types of chemicals. One are acids and the other are alkaline burns. Okay, so there are many types of chemical burns, but the alkaline burns are more severe in nature because they can cause liquefaction necrosis. So typical alkaline burns, they go much deeper than the acid burns. Okay. And with chemical burns, for most other burn cases, the way you treat them, the emergency room, you wash them with running water. Okay.
Okay. Yes.
But for chemical burns, especially for chemical powders, you don't wash them with water first. You make sure to dust off the dust particles, because if you wash it with water immediately, it can elicit an exothermic reaction. Okay. So aside from having a chemical burn, there will be an overlapping thermal burn. So you'll have two problems. Okay. So for chemical burns, so alkaline and acid. So acid is much more milder compared to alkaline burns.
Okay, that's great to know, doctor. You know, we learn about pH stuff like acid and alkaline and balancing that. But of course, this is maybe related to that, but a different case. As you said, the first thing that would come to mind when you say, "Oh, somebody got an acid burn from a chemical burn," that it would probably be more serious. But as you said, the alkaline burns can be more
More
dangerous.
serious.
Yes, and in terms of treatment, you're giving us some tips already now, like what you do in the emergency room. When it's an acid burn, you don't wash it with water because the acid might.
No, only when it's
Mhm.
only when it's in powder form.
Okay.
Okay, but chemicals in liquid form,
Mhm.
you can wash it off with water.
Doctor, could you give us some examples? Just a common example, like of how you can get a chemical burn. Like, I've heard that even isopropyl alcohol can burn your skin off, or is that a key? Mm-hmm.
Yes, if it's too concentrated, but mostly household chemicals like muriatic acid, the one
Yeah.
which we use to clean our toilets.
Yes.
If you mishandle them, you can get burns from them.
Mm-hmm. Yeah, I've seen muriatic acid. I mean, if you throw it on a floor of marble, it can just burn it up. So yeah,
Yes.
that's right. So there are things in our household that we also have to be aware of. As you said, if you mishandle certain chemicals in your household, it doesn't have to be a scenario where you work in a chemical factory and all this. No, these things can happen at home. Okay, doctor, you also said there are electrical burns. How does that, can you give us an example of one? Like, would it be putting something into plugging into a socket and then it explodes or something like that?
Okay. So there are two types of electrical burns. There's a low voltage and the high voltage electrical burns.
Mhm.
So for the low voltage electrical burns, it's usually less than 1,000 volts. For the
Okay.
high voltage, it's above 1,000 volts. So common scenarios for electrical burns, for example, for children, when they play
Mhm.
with electrical sockets,
Aha.
when they put metal objects into the electrical sockets, that's the most common scenario for children.
Mhm.
And then sometimes we see some of patients wherein they go to their rooftop, they try to fix something, the antenna or something,
Mhm.
they try to get something from the tree, and they're
Mhm.
using a metal pole, and then the metal pole comes in contact with the electrical line. So that's
Mhm.
another common scenario for electrical burns.
Okay, that's great. I mean, it's great that you're giving us scenarios because it's very common to do this at home and do the fix-its, and then also, like, if your sockets aren't covered, there are so many children that have been not just electrocuted, but apparently you can get a burn from that. That's an example of
Yes.
an electrical burn. Okay, and then you mentioned another type of burn. I don't know if that's like, maybe if you would that be like, what if there's a pot or of boiling water and you touch it? Contact burns, is that what you said?
Contact burns, yes. So a contact burn is when you come in contact with a hot object. So
Mm-hmm.
it could be metal, could be stone. Okay,
Mm-hmm.
so
Ah, yeah.
yeah,
Mm-hmm.
so contact burns.
Okay. So if you come in contact with me, I'm a hot object, you might burn. I'm just kidding. Okay. Okay. Just to lighten up the conversation a little bit. But of course, we are getting to serious things, as we always do on Healthline with Makati Med. We have experts like Dr. 𝗛𝗲 who give us good advice, who give us information, and then, it's very educational. So yeah, today we're talking about burns, and let's talk more about it. Doctor, what are some of the preventive measures that people can take to avoid the common causes of burns that you mentioned? And it seems that you can get burned just doing things around your house, no?
So actually, prevention is the
Mhm.
best cure. Okay, so always think of your safety.
Mhm.
So always wear your protective clothes when
Mhm.
working with chemicals, or
Mhm.
when working with electricity. Make sure that you're well insulated. And
Mhm.
then always there should be presence of mind when handling dangerous chemicals or hot liquids or hot hot stuff. So
Yeah.
always presence of mind, not only for you but for the people around you.
Yes. Like, I mean, doctor, like, let's say, you're trying to multitask and you have hot coffee, you brought it to the car or something, and then you're using your cell phone. No, that's a bit distracting. As you said, presence of mind. because an accident can happen. You can spill your coffee or the kettle of water. Diba tayo rin dito sa Pilipinas, mahilig tayo yung mag ano ng tubig, yung
Yes.
there's a kettle and then you plug it in and then you know, it's for hot water, either for taking a shower, for making coffee, whatever it is. You can get a contact burn from that. You can also spill the water inside. So as you said, just always think of your safety first. Presence of mind, of course, is most important. You also mentioned wear the right equipment. I guess if you're going to, you know, you see that there is maybe like when you talk about electrical burns, like if you're gonna try to fiddle with something that has electricity, will like wearing rubber help? Shoes.
Yes.
Or rubber gloves. I mean,
Rubber, yes.
Yes. I mean, something that doesn't, don't
Conduct
expose
electricity.
skin. Yeah, something that doesn't conduct electricity. So those are very good tips, doctor. And thank you for giving them to us on the show. And like coming from someone like you who's an expert in this and who treats people with burns, it's good to hear that you mentioned prevention, of course, is the best, you know, is the best way to not get burned and end up in the ER or end up on your operating table, even perhaps for us to stay safe and avoid burns. Okay, and then doctor, do you notice if there's a certain demographic or even maybe a certain time of the year when you see a lot of patients coming in with burns?
For the demographics, it's usually from the lower classes.
Okay.
Because from the lower classes, sometimes they have no electricity, so they still use what they call this, the lampara,
Yes.
the lamp, that's
Kerosene lamp?
kerosene lamp. Yes.
Okay.
So sometimes when they neglect the kerosene lamp and it falls down, it can cause a fire. Okay, and then also when they cook, yung siga method, they use wooden stoves for cooking, and then they use yung flammable materials. Yes.
Okay, wooden chips or maybe even some coal, anything, you know, like paper rolled up just to get the fire going, and then it kind of gets out of control.
Yes.
I mean, fire is one of those things that it's, you know, it takes a life of its own. Okay, so you do see this demographic, people who live in houses who are not yet electrified or areas that are not yet electrified. So
yes,
this is one of the demographics that you see coming in usually, who get either maybe not serious burns or serious burns. And we'll talk more about serious burns, the severity of burns, and all of these things. We just need to take a short break, doctor, and the audience will be right back. Stay tuned to Health Line with Makati Med, only here on DZRJ 810 AM. And Facebook/DZRJ Radio Bandido, DZRJ 810 AM Radio Bandido. Okay, Doc, guys, stay tuned. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Gia Season from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. we look forward to serving you here at Makati Med Care Access, Araneta City.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are here today with Dr. 𝗛𝗲𝗏, and we're talking about burns. As I said earlier, Dr. 𝗛𝗏𝗏 is a plastic surgery specialist, and I did say that, when we think about plastic surgery, we usually think about beautifying ourselves and all of those other procedures that are also important, but their plastic surgeons are the ones who are the experts and who treat the victims who have severe burns. Okay, so doctor, maybe we can talk about, how do you determine the severity of the burn? Paano ninyo nakikita at nagdedesisyon na, itong burn masyado siyang severe, ito parang okay lang, hindi ganun kalalim or hindi ganun yung pagkasunog sa kanya?
Okay. So, first of all, konting background muna about the skin. So, the skin has two layers. The epidermis, the outer layer, and the dermis, the inner layer of skin. Okay? So, it depends dun sa level of injury, kung yung classification ng burn. Okay? So, usually you hear first degree, second degree, third degree, and fourth degree burns. Yan yung common na knowledge sa general population. But for us in plastic surgery, we classify them as superficial burns, partial thickness burns, and full thickness burns. Okay? So for superficial burns, ito yung pwede mong halintulad sa first degree burn.
Okay.
Sa superficial burns, it's only the epidermis that is injured. The dermis is okay, only the epidermis is injured. Okay? Ang common example ng superficial burn is a sunburn. And then, usually, it will heal in 3 to 5 days. And all you need to do is apply moisturizing lotion to facilitate yung epithelialization ng skin mo. So, in 3 to 5 days, magaling na. So, yun yung example ng superficial burn. So, for the second and third degree burns, yun yung tinatawag naming partial degree burns. Dalawang klase yun. You have your superficial partial and your deep partial burns. Okay? Usually, mahirap silang i-differentiate from one another. It will take several days of observation bago mo malaman which of which. Pero, some signs para yung superficial partial or yung second degree burns na tinatawag nila is usually moist and very painful to touch, tapos usually colored pink.
Okay.
Ang superficial partial burns, yan yung typically nakikita mo sa mga scalp burns, yung mga nabanlian ng mainit na tubig. And then, usually it will heal in 2 weeks' time. Pero pag nag-heal, minsan nagkakaroon ng mga pigmentary changes. Yung mapapansin mo yung balat, either mas maitim or mas lighter in color than yung normal skin mo. Yung isa naman, yung pang third degree burn na tinatawag nila, yun yung deep partial thickness burns. Mas malalim ang injury nun into the dermis, okay? Kasi yung superficial partial thickness involves the epidermis and the first part of the dermis. Dun sa deeper na partial thickness burns, it goes into the second layer of the dermis, which is the reticular dermis. Tapos ang characteristic niya is usually mottled pink or white ang color and dry na siya and hindi na siya painful. Usually, insensate na siya.
Okay.
And then, yung last yung tinatawag yung mga fourth degree burns, ang tawag namin doon, full thickness burns. Yung full thickness burns, yes. The whole skin, the epidermis, the dermis, injured na. So usually, what you see is underlying fat, muscle, or in worst case, bone. Okay? So yun yung mga degree ng burns. And then, isa mo pang kailangang i-quantify is the percentage of the body area that is burned. Ang pag-calculate nito is you only include the partial thickness and deep thickness burns. Hindi mo isasama yung superficial burns. And then, meron kami mga charts na sinusunod para quantify kung ilan yung total body surface area burned. Kasi it goes to show, the more na mas mataas yung body surface area burned, mas mataas yung mortality.
Okay. So just to recap, doctor, and please jump in and help me out or correct me if I'm wrong. You're
Okay.
talking, okay, we're used to hearing general public, just like me. First degree burns, second degree burns, third degree and fourth degree burns. When it comes to first degree burns, those are like as you said, the most common example is a sunburn.
Sunburn.
And a lot of people actually, they go to the beach and like, I got sunburn, they don't mind it. But if it's painful, you said like one of the ways to treat it, like we can treat it ourselves, is to put, or the best way to treat it, you said, is to put moisturizer. So that would be
Moisturizing lotion, yeah.
Okay, moisturizing lotion to get the skin to start moisturizing itself, because it will heal itself. And as you
It will
said,
heal itself in 3 to 5 days.
3 to 5 days. Okay. And then so that would be like a first degree burn, an example. The second
Yes.
degree burn, you said, so because there are scales within there's like a scale within the degrees of burns.
Yes.
And for plastic surgeons, you have different terminology for it when you evaluate a burn. For second degree burns, okay, a first degree burn is when you said the skin has 2 layers. So the top layer would be the epidermis.
Epidermis.
Under is the dermis. For secondary degree burns, the burn goes down to the dermis already.
To the dermis.
To the dermis.
The first layer of the dermis, yun yung second degree or the superficial partial thickness burns.
Okay. Superficial partial thickness burn. That's the first layer of the dermis. Now, if it goes down to the second layer of the dermis, that's what you call a third degree burn.
Third degree or the deep partial thickness.
Deep partial thickness. And then for the fourth degree burn, you would call it a full
Thickness.
burn. Okay, now
So
for the
it
second.
involves both epidermis and dermis.
Okay, both epidermis and dermis. So, okay, so I'm understanding that with a second degree burn, I mean, is it true that it hurts more than a third degree burn?
Yes, because in a second degree burn, usually the nerve endings are still viable. So talagang masakit. Okay,
And
but in a third degree or the deep partial thickness, the case is the nerve endings are already injured. So usually insensate or variable sensation.
So like for a patient, let's say who gets a second degree burn, it is the most painful because andyan pa yung nerves, and our nerves on the skin send signals to our brain saying, I'm hurt, it
Yes.
hurts.
Yes.
Pagdating sa third degree burns, parang you don't feel it na because the nerves are burned off.
Yes.
No? Or they're injured.
Yes.
But of course, it's a more serious burn. And then
Yes.
when it comes to fourth degree burns, that's really like the most serious because somebody could have been burned down to the bone. As you
Yes.
said, you can see when you look at the skin or the surface, you can see fat already or even bone. And plastic surgeons and other experts who treat that, who work with your team to treat those burns, you also evaluate this how much of the surface of the body has been burned.
Yes.
For example, if it's only the arm, then you're not that worried about it. I mean, of course you're worried, but if it's the arm, the back, the shoulders, like the bigger the surface is of the burn, the more serious it can be. That goes into your calculations, and it can even lead to fatalities.
Yes.
Even
Actually,
days after, no, doctor? Like, if you get to someone and they're burned, I mean, even if you treat them, there are cases where days after, parang, is it that the body keeps burning? Like the burn a long time.
hindi naman na the body keeps burning,
Mhm.
pero the more surface area of the body is burned, mas malaki yung inflammatory response, and
Mhm.
then the inflammatory response will actually lead into multiple organ failure, and then
Mhm.
that yun na,
Okay.
mortality na.
So if the bigger the surface of the body that's burned, it's our own body that sends out an inflammatory response. And
Yes.
so that one, it taxes our body. Parang pinapahirap yung katawan
Yes,
natin.
it sets off a chain of reaction sa body natin, na madaming changes, hindi lang dun sa burned area, kundi systemic na siya.
Okay. So, like, when you treat people who have fourth-degree burns, you know, you also have to treat the other parts of the body that are reacting. Kasi yung katawan natin yung parang nag-shut down.
Yes.
Because may chain reaction, like, I don't know, our immune system, tas namamaga dito, namamaga dyan, tas nahihirapan na yung katawan. So our bodies get taxed, and it can even lead to fatalities after the fact that you've already started treating the patient. Okay, so thank you, doctor, for telling us about like the different types of burns, and the general public, we learn first to fourth degree burns. But for you guys, thank you for telling us how you treat it, because it's very interesting to know, and it helps us like be more careful. Okay, I actually met someone who, just as an example, she was cooking. I mean, she exercised, and then she was cooking, but her exercise clothes were flammable, and then it caught fire.
Caught fire.
It became a really serious thing. Like, she needed plastic surgery because her skin and her arms, even her face, her chest got burned. But it was people like you who had to treat her for quite some time. So, plastic surgeons like yourself really help people get through these things. So I guess, like what you said earlier, presence of mind is, of course, the most important thing. So, I mean, this may be like a very obvious question, but what is the most difficult or dangerous type of burn to treat? Is it the fourth degree burn because of what can happen, or is it the third degree burn? Like, what among them is the most sort of insidious, like, that creeps up on the body?
Okay, so before I answer your question, it's the types of burn. Usually electrical burns are more serious. Number one, because when the electrical current goes into the body, okay, hindi lang skin ang involved, pati yung mga underlying tissues na dinaanan ng electrical current. For example, the subcutaneous tissue, the fat, or the other organs, pwedeng maapektuhan. Hindi tulad nung ibang burns na, kunwari scalp burn, alam mo kung saan lang yung area ng involvement eh. Pero ang electrical burn kasi, it can involve totally the whole body kasi dumaan doon yung kuryente.
Yeah, I mean, we hear of sad cases where we have electricians who are working for electric companies or government electric companies, and then they're on yung sa poste.
Yes.
They're on the electrical post, and then they're fixing it, and then they get electrocuted and also burned. So it's like what you're saying, those are the most difficult burns to treat, because I mean, maybe the guy or girl had a heart attack.
Yes, that's possible.
Okay, because of the getting electrocuted, or maybe it set off something in their brain. So those are the most, I mean, it's great that you told us. It's such knowledge that maybe one of the most difficult or most serious or hardest burns to treat are electrical burns, because it's not just the surface that is burned, but the body. You have to deal with everything else that happens.
Usually yung manifestations days after pa ma-observe mo, so you have to wait at least 5 to 7 days. Doon mo lang makikita yung extent of injury for electrical burns. And then to answer your question, as you go higher the scale doon sa grade ng burns, syempre mas mataas yung mortality and morbidity. Okay, so pag superficial burns, you get healed in 3 to 5 days. The superficial partial, in 2 weeks time, you're okay. For the deep partial, it takes 3 to 8 weeks for you to get healed. Okay, and then for the full thickness burns, actually you need excision and grafting na, because wala ka ng skin nun eh, nasunog yung skin mo. Pwedeng pag gumaling nun, hindi skin ang kapalit, scar na.
Okay.
And then yung scar na yon, pwedeng malimitahan yung function mo.
Because of the scar, like, because you got burned and then there's no more skin, And skin our skin grows back, but because of the severity of the burn, the skin cannot grow back. It will be scarred.
It depends on the severity of the burn. Okay? For the mga superficial burns, the skin recovers. But for the deeper burns, you lose your skin. So you need to replace your skin. Otherwise, scar ang papalit.
Okay, you need to replace your skin. And maybe that comes with some of the techniques or reconstructive surgery that doctors like you perform. And let's get into that after we take this short break. So everybody stay tuned and we'll be right back. We're talking about burns with Dr. 𝗛𝗶𝗶, a plastic surgery specialist from the prestigious Makati Medical Center. Stay tuned to Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗶𝘶 and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center. Hi, this is Dr. 𝗂𝗶𝘶 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We have Dr. 𝗛𝗶𝗶 here with us. He's a plastic surgeon or a plastic surgery specialist, and we're talking about burns today. and how burns are treated. Earlier, Dr. 𝗛𝗲 explained like the different degrees of burns and how they're identified by experts like himself and others who are on the team treating those with burns who are brought in. Doctor, before we talk about the reconstructive maybe surgery process that you guys do, can you? Oh no, you already explained to us that you sort of describe some of the burns. I do have a question for you though, that usually when somebody gets burned at home or elsewhere, we learn these first aid things, right, in school. And I want to ask you, can you give us like basic first aid? Because of course, people who are not doctors like yourself or medical professionals, they want to help, and rightfully so, but they might be doing the wrong thing. Can you just give us like some basic guidelines for treating a burn? Because they might not see that it's a first, second. Obviously, if it's a fourth degree burn, they'll see the bone. Like, what should they do first before they get the patient to the ER or to you?
Okay, so first of all, so you, for example, your clothes caught fire, or you spilled hot drinks on your clothes, so you remove that article of clothing.
Okay.
And then you wash the area that got burned with running water. Okay? And then yung common na nakikita ko, nilalagyan ng toothpaste. That's a no-no. Okay?
Yeah.
Hindi mo dapat lagyan ng toothpaste. Okay? So, like I told you, for superficial burns, any moisturizing lotion will do. Okay? But for deeper burns, yung mga nagbe-blister, okay, ideally, dapat aalisin lahat ng dead skin. Lahat nung yung blister na yon, you have to remove it. And then, you have to coat the burned area with a topical antibiotic cream. Okay? Topical, hindi natin kailangan ng yung systemic na, or yung oral or yung IV na antibiotic, because wala silang role sa treatment ng burns initially. Okay? So, all you need are to keep the burn wound clean. So, you clean it every day, soap and water. And then, kasi yung iba, pag nagkasugat, all the more na hindi nila nililinis bawal daw basain. So, that's a no-no, because lalong mag-proliferate yung bacteria doon. So, when you have a burn wound, you have to clean it every day with soap and water. And then you dry it, then you apply the topical antibiotic cream. Okay? So, depende sa degree ng burn mo, yung kung ilang days before it heals. Okay? But for mga burn wounds that takes longer than 3 weeks to heal, most probably it will not heal and you will need skin grafting.
Okay. Thank you, doctor. Just to recap what you said, if we get wounds at home, or people we know get wounds at home, burn wounds, the first thing you do, of course, is if it's burning or nasunog dahil sa suot mo, take out that piece of clothing.
Yes.
And then I guess just stop the fire or burning, remove the contact, and then remove the skin from the contact with whatever's burning. I've seen some people are their hands are burning, but they don't want to let go of the they're kind of frozen, like they don't let go of the thing that's burning their hands. Or like, even if you eat food that's too hot, they're like I think you should just spit it out, no? But just to follow what you're saying, if you're gonna treat it at home or look at it, you should treat it with running water. So
Yes.
Open your faucet, or if it's 𝗪𝗪, something that's running, and that is to help with any bacteria that might form. And you did mention to wash with soap and water, mild soap and water lang po, di ba?
Yes.
Yeah, any mild soap, wag yung mga parang you put the laundry soap or something.
Huwag
No.
yun.
Just
Oo.
mild soap.
Mild soap lang.
Mild soap, get the burnout, and you have to clean it. You have to wash it every day. And as you said, no, there's this parang it's a lot, you see that a lot of people put toothpaste. Before they used to put butter. No, that's a no-no. Maybe the toothpaste feels cold at first, but it's not meant to treat burns. You
Yes.
also mentioned that people can treat it with a topical antibiotic. Like at first, you don't have to take systemic antibiotics, which are like oral antibiotics or antibiotics that we get in the IV, because I guess we're treating the skin, no? And
Yes.
there are creams there, no, doctor, that are I don't want to mention brands, but there are topical antibiotics. You can ask for a cream, or just whatever they call it, because sometimes they call it a cream, they call it a formula, whatever it is, treat with a topical antibiotic. You mentioned blisters, doctor.
Yes.
What do you call that in Tagalog? When your skin is already
Paltos.
paltos?
Paltos, yung Tagalog ng blister. Oo.
Blister. Burns can cause. Would that be a first or second degree burn kung may blister?
That's a second degree. That's a superficial partial thickness degree burn. And then you have to remove the blister.
You have to take it out.
Take it out, and then clean with soap and water, and then apply antibiotic cream or ointment. The goal of the antibiotic cream and ointment is to prevent bacterial colonization, and you give enough time for your skin to recover.
Okay. So when you say bacterial colonization, the goal of that is para hindi tumubo yung bacteria.
Yes.
You don't want bacteria to grow there. Okay.
Yes.
And then, doctor, so beyond all, I have some people would put ice. Is that a no-no, or yes, we can do that?
Yes, you can do that. But you have to be careful also with ice, because if you put too much ice or too much cold, okay, you can develop naman hypothermia.
Okay.
Okay. So you can put ice to cool down yung area, pero you have to make sure that it doesn't stay too long.
Okay. Thank you, doctor. So we've gotten all these we've gotten all these tips from you on how to deal with it first at home. And then now, if this isn't healing, you mentioned skin grafting again. It's the second time. Can we talk a bit about skin grafting? And is that a surgical technique already? Is that one of the surgical? Okay. Can you tell us about skin grafting, and then perhaps walk us through some of the other surgical techniques that you use to, reconstruct skin? As you mentioned, wala nang skin, so you have to do skin grafting, or let's get down to what you do, like your expertise.
Okay. So the gold standard for the treatment of yung deep burn wounds is actually burn excision and grafting. So you have to do it early. Because before, the practice was they delay it hanggang mag-fall off yung scar, yung burn wound, hanggang mag-fall off yung scar niya, saka lang nila i-address. Pero yung practice na to, it increases mortality, morbidity, it prolongs hospitalization. So the trend nowadays is you do early. If you see the wound not improving within a couple of days, you excise the burn wound and you do skin grafting. So when you say skin grafting, there are two types of skin grafting. There's the partial split thickness na skin grafting, and there's the full thickness skin grafting. So what's the difference between the two? For the split thickness skin grafting, you only take part of the dermis and the whole epidermis. So actually, may matitira pa ring dermis sa skin for the skin to regenerate. So that's partial or split thickness skin grafting. For full thickness, you take the whole skin. So ang makikita mo na lang fat. Okay? So for burns, actually, you can use, depende sa area of coverage. For the face, syempre mas maganda yung mga sheet grafts. Pag sinabi mong sheet grafts, it's a split thickness na skin graft, pero you don't put holes or you don't mesh it para mas maganda yung healing niya afterwards. But for other areas of the body, you can apply split thickness and then you mesh it. Pag sinabi mong mesh, we apply, we divide it para mag-stretch yung skin, para konti lang yung kailangan mong i-harvest na skin. Because sometimes for big burn wounds, you will run out of donor areas. So speaking of donor areas, the most common sites of donor sites for skin grafting are the thighs, sometimes the stomach, and the back. Pati buttocks kasama.
Okay. Thigh, stomach, back, buttocks. Okay. Doctor, I have a couple of questions here for you. So you explained to us, you walked us through some of the processes that you follow when it comes to skin grafting. You mentioned burn excision first, and you said before, the practice was to just sort of let the patient see how wait till I guess the dead skin or
Yes.
whatever falls off. But these days, if you see that it's not healing and there's dead skin, you actively go in there and remove it. Is that so? Do you like remove, like, how do you do that? You use like it's really like a hand to hand thing. Like you look at it and then you take it out. You take out the skin.
Actually, you can use manually. There are two types of excision pero masyado ng scientific, that tangential excision and the fascial excision. Okay, tangential excision, you go through it bit by bit. Pwede yung manual, okay, you using your pickup and your blade, unti-unti mong tinatanggal yung burn wound hanggang ma-expose mo yung viable na wound bed. Okay? That's tangential excision. Yung fascial excision, diretso ka na sa fat kagad.
Okay.
And then usually you use a cautery machine. So the difference between the two, for tangential excision, so bit by bit, mas madugo. Okay? Yung sa fascial excision, diretso ka na dun sa fat, so may plane ka kagad na sinusundan, and with the use of cautery, less blood. Ang disadvantage ng fascial excision is maaaring nasobrahan yung tinanggal mo kasi you went straight down to fat So baka naman pwedeng you could have gotten away with a smaller na
So there are times when you will sit with a patient and remove it manually, no? And as you said, that's the first type of that's a tangential excision.
Yes.
So whatever you see there, I guess it's a tangent. Like it's visible to your eye. And you said it's madugo, meaning it's a long process, and the patient also has to sit through that, the removal.
You do that under anesthesia.
Under anesthesia, okay. So, and then there's another type where you just go straight to the fat and use a machine. But the problem with that is maybe the allowance, the allowance between that, like you could have used some skin there.
You could have saved some of the layers. Okay, with a fascial excision, you remove everything na. So medyo mas aggressive siya.
Okay, so it's a more aggressive treatment. And then down to the skin grafting, you mentioned a split full thickness. That's the first type, where
it's either split thickness or a full thickness. Yes.
Okay, split thickness or full thickness. With split thickness, again, it's part of the
you leave part of the dermis.
You leave part of the second layer.
Yes. So skin will regenerate.
Okay. So skin, because it can heal itself, it just takes time.
Yes.
Okay. Now with the full thickness, that's the whole thing already. You
remove the whole skin.
You remove the whole skin and then you replace it with another one. And doctor, with skin,
pag full thickness, ang downside ng full thickness, you will have a donor site na open na you have to close.
You have to close, okay, because it's an open wound.
Yes. Ang split thickness, may skin pa rin doon.
Okay.
So you just have to cover the skin with something na to prevent desiccation. Pero sa full thickness, you remove the skin, fat na lang yung matitira doon.
Okay.
So yun, kailangan mong i-close yung donor site.
Okay. Now, when you talk about donor sites and skin grafts, you get the skin of the patient mismo from other parts of the body?
Ideally, it must come from the own patient. Okay? So, ang usual donor site namin comes from the thighs.
The thighs, okay.
Yes. And then sometimes, pag hindi pwede yung thighs or kulang yung you can also get from the stomach, from the belly, from the back, from the buttock.
Okay, and from our butts. So, as you were saying, when you usually the thighs, are you happier when you see fatter thighs, bigger sites?
Sometimes, because mas malaking surface area na you can work with. Okay. And then, syempre, you have to bear in mind na if you can keep the donor sites in a conspicuous area, yung hindi siya obvious, so the patient kunwari can still wear shorts. Okay, so yun yung mga considerations mo when selecting a donor site.
Upper part of the thigh maybe, and then the butt, it's not always exposed.
Yes.
I mean, I would imagine it's not always exposed, the butt, no, our buttocks, yung mga puwet natin. And then also like parts of the back. What part of the back do you usually get? Because the lower part, the middle
Lower part, yeah.
part, okay. So people can still sometimes go backless if they want. I mean, you're very considerate also of how people would look and feel, no?
Afterwards, yes.
Yes, afterwards. And then the belly also, you said, yung mga tiyan natin. So you can get skin from that, and you can graft it. So you take out the skin from the patient mismo, the patient
Yes.
herself or himself, and you put it on the site, that the open wound or the site that needs skin replacement.
Yes. Actually, speaking of replacement, meron kaming concept in plastic surgery. You replace like with like. Okay? Kung kaya mong, for example, you need to resurface something, for example, the eyelid, ang ideal na donor niyan is the other eyelid. Para parehas siya ng nung quality ng skin. Okay? So if you can harvest from a similar site to replace yung skin that was lost, mas maganda yon, yung similar skin. Pero kung hindi kaya, yun yung mga sites na minention ko na usually ginagamit namin.
So that's great. And you told us that in plastic surgery, you have you always try to replace like with like.
Yes.
So as you mentioned, so if the burn, for example, is in the arm, maybe you'll try to get from the other arm.
Yes.
And the sites that you mentioned for skin harvesting are like, well, there's maybe the surfaces or a lot got burned, and when you can't replace like with like, you get from these areas, the thighs, the belly, the back, and the butt. Okay, thank you, doctor. Now, when that happens, no, when you decide that, and the patient also agrees that they need reconstructive surgery, how do you prepare for it? Are they in the hospital, or can the patient wait at home? How does this happen? Do they need to do things, or do you need to do things to them to make sure that they're ready for this procedure?
Okay, so usually when you get burned, you get admitted in a hospital. Meron kaming criteria for admission, okay? And then if your burn is really bad, so you will spend some time in the hospital, and then you will probably need burn reconstruction. Okay, so the timing of burn reconstruction, meron yan 3 phases. Pero ideally, burn reconstruction should be delayed until all scars or all wounds have healed and the scars are mature and soft. Okay? Pero there are instances where you don't have to delay the reconstruction. You can go in acutely. For example, I'll give you an example. Kunwari may burn wound involving the eyes, wherein the eyes got burned and exposed yung cornea. So you don't wait na kasi magkakaroon ng exposure keratitis. So you need to do something to cover the eye. Or kaya yung mga ibang burns which results in, for example, a microstomia, yung small mouth. You need to correct that immediately. Or some burn wounds involving the neck wherein there's a contracture and the patient has respiratory embarrassment, hindi siya makahinga ng mabuti. Yun kailangan mong gawin yung kagad. Okay? And then the other time period, yung tinatawag nilang intermediate time period, wherein it involves some of the joints. Okay? Because sometimes when you develop burn contractures of the major joints, maapektuhan yung function mo. Hindi mo ma-stretch yung arms mo, hindi mo ma-lift yung yung arms mo. So you need to release those contractures. Okay? And then the last phase nung burn reconstruction, yung you can delay pag yung it involves the passive areas of the body or those involving yung aesthetics na pampaganda na lang or yung mga pigmentary changes, yun. So three phases of burn reconstruction. Okay, yung acute, doon talaga sa mga kailangan gawin mo na kagad. The intermediate, para maka-function ng mabuti yung pasyente. Tapos yung last, yung last part, yung delayed na, yung mga hindi masyadong important na parts ng body.
Okay, so great, doctor. Just to recap, and please jump in anytime and correct me or clarify anything. For what I understand is that you have three phases. One is acute, when you do, when you come in and do reconstructive surgery, and those are for things like, as you mentioned, the eyes, because we can't have our eyes exposed, right?
Yes.
Or the mouth. I mean, there are things that need to be covered. So as plastic surgeons, as doctors treating this as the experts, you know that you go in right away. It's called acute. You have to treat it right away. You have to do the reconstructive surgery right away. And then for the intermediate, it's things like, for example, it can wait a little, but you still have to treat it as soon as you can. You did mention, let's say, bone joints, like let's say
Release of contractures ng mga joints, yes.
like you got burned around your elbow, and or your knee, and you want to put skin in that area so that you can use it. It's functional, no? Your elbow.
Actually, usually minsan hindi mo kailangan ng skin. For example, may contracture, the burn wound healed in a bad way like that. So all
Yes.
you need is to release the burn wound.
Mhm.
Okay, we sometimes use incisions
Mhm.
na to relax the burn wound, or sometimes we cover it with flaps. Pero pwede rin skin grafts, depende sa need.
Depende sa need. Okay, it depends on the need. And the third phase, or the third part where it's delayed, you can delay it, is when, like, it's things to improve the look,
Yes.
to make it look more like the original skin, the original features. And of course, you're doing this in phases because, as you said earlier, ideally you would want to wait till for a time when some of the burns have healed and you can see
Yeah,
the full.
all the burn wounds should have healed, and then the scars are mature and soft.
And soft. Okay, so
And
it's
then
not
also, you give adequate time for the rehabilitation to take place. So ang burn care kasi hindi lang plastic surgeons ang involved. It's a
Mhm.
team effort. It involves the burn unit nurses, the PT, the OT, meron din mga dietitian, tsaka mga psychiatrists dyan na involved. Okay?
Yeah.
So, para holistic yung approach natin sa burn, And
Okay.
then, yun. So, in phases ang pag-reconstruct, ang burn reconstruction.
So, I mean, most of the time the patient is admitted. As you said, the burn nurses, of course, take care of the immediate needs or any kind of pain. Then you give instructions for any type of medicines, no? And then there are PTs, so physical therapists, to get them walking and moving again. Occupational therapists, you said OTs. Those are the finer movements.
Fine motor movements.
Fine motor movements. And then also psychiatrists, very important because, it affects mental health of patients.
Yes.
And their families also, their loved ones. I mean, and as you said, you approach it in Makati Med, at least where you practice, you approach it holistically as a team. Okay, that's great to know that you really treat it in a manner where it's you're treating not just the patient's wounds, but also their state of mind and their mental health, because that's very important, even for patients to recover or to want to recover. I would assume that when you get burned and you have these changes in your body, it's not only painful, but you kind of want to go back to who you were before or what you looked like. And have you had I'm sure, like, you hear all of the the crying or the problems or the maybe the family. Is it in your practice, have you seen a lot of patients who really need a lot of help with their mental health?
Yes. Some patients, they experience depression. Okay? During admission and after admissions. So, kailangan talaga ng strong support group from the family. And then, so team effort talaga. And then, pati yung patient has to communicate with us kung ano yung mga goals niya. Okay?
Not like the patient should say, I don't just want to be functional. I don't want to see skin pigmentation, or I want to look a certain way again. And also, doctor, this is just a reminder to a lot of people out there, kasi sometimes, when you see maybe a burn victim or something, and you stare, it hurts them, makes them feel different. So, I mean, I'm not saying look away, just treat them like normal people, but they have normal people who are going through something. Kasi nakikita ko yan eh. Have you, like they're very conscious, no? And as you said, they need a full support group from the family, moral support, also psychiatrists, patients, doctors, and as you said, no, it's very important. This is one of the first times that I've heard the patient has to communicate what they want, what their goals are. So have you encountered patients who do not want to talk about it?
Yes.
Okay. And that's for you, you have to pull the information out of them.
Yes. Before we can help the patient has to help him or herself dapat. So, yeah.
All right. Doctor, how do you manage the pain associated with burns as a doctor? Because of course it's very painful, no? And just like in whatever stage it's in, whether it's a burn that's being treated or a burn for reconstructive surgery, how do you how do you manage that for the patients, the pain that they
Okay.
have?
For burns, the type of pains, number one, meron yung background pain. Pag sinabi mong background pain, yung always present because of the burn injury. Tapos meron tayo yung mga procedural pain. Yung procedural pain, every time you do something to the patient, for example, you change the dressing, you clean the wound, na nag-i-increase yung kanyang pain. O meron din minsan yung breakthrough pain, miski wala kang ginagawa, and then the pain shoots up. Okay? So usually, for burn patients, we use opioids. Okay?
Okay.
So there's long-acting, there's short-acting opioids. So for the background pain, we usually administer yung mga long-acting. And then, for the procedural pain, and then yung mga breakthrough pains, we can supplement with yung short-acting or some of the NSAIDs na tinatawag nating group of pain medications.
So, doctor, for the background pain, it's constant. It's always there. You
Yes.
do use opioids, and these are things like maybe like hydrocodone or
Oxycodone, morphine.
morphine. Okay, and they need it. The
Yes,
patients.
of course.
And is it usually administered through IV or through oral? It depends.
It depends. Pwedeng IV, pwedeng oral.
Okay. And for the procedural pain, and it occurs, like you said, like if you change the dressing, it hurts. Or the breakthrough pain that you said that it just shoots up, no? You sometimes add on things like NSAIDs and non-steroidal anti-inflammatory drugs.
Yes.
What if the patient is allergic to NSAIDs or you can't? Do you use opioids to supplement or?
Pwedeng short-acting opioids, pwede ring mga centrally acting na painkillers, or sometimes paracetamol. Paracetamol, is good analgesic. It's also an antipyretic na madaming benefits for burn patients.
Okay, great. Okay, so at least patients know that it's already painful, that you will help them manage the pain by giving them medication that they really need. Okay, so of course, you would recommend these types of medicines or prescribe them to them, and perhaps if they're in the hospital, nurses would give it, or if you have some like cases where they're at home waiting to come in, and then the family helps administer the medicines also, or it's all
usually kapag pag outpatient, usually oral na yan eh, na oral medications na yung binibigyan namin for pain.
Yeah, and then they're waiting for the time when their burns are healed enough for you to do more of the procedures or get the patient to where they want to be. And as you said, their goals, no?
Yes.
How do you minimize? I have a question. Like when you do the skin grafts, no, and you replace the skin, and the patient is okay, does it automatically, because the nerves that were there before in the skin, does it automatically like connect to the brain? I mean, like can like when you move and it's maybe a new type of skin, does it automatically connect? Like when you replace the skin, is the skin kind of like that you don't feel anything there? or it automatically connects to the brain?
It takes time for
Takes
the
time.
nerves to regenerate.
Mhm.
Oo. So hindi siya instant.
Okay.
So it takes weeks to months of recovery for you to be yung sensation ba pinag-uusapan? Yeah.
Sensation, yung
Bago
maramdaman.
maging normal. Yeah, weeks to months ang binibilang.
Kasi pag unang nilalagay, parang hindi pa siya like wala ka masyadong mararamdaman. So that's normal. But
Yeah.
as you said, the sensation, what you term as sensation, it takes weeks to months until it gets normal. So it does reconnect. In a sense, I mean, simplify it, it does reconnect. Okay. That's good to know. Also, have you had any cases where you can't get skin graft from the patient? You get it from like another donor, like a family member or
No, personally, wala pa akong experience na getting skin grafts from another person to be used sa pasyente. Pero if you read on the textbooks, it happens. You can get from a same species or a different species.
Oh.
Pero in first world countries, they have skin substitutes already. They have what do you call this? Synthetic skin, or sometimes there's a brand. I won't mention the brand wherein you put it in the burn wound. Okay, it's a bilayer. So the inner layer it acts as scaffolding for future skin grafting. Tapos yung outer layer it protects the wound. So you leave it there for 2 to 3 weeks, and then after 2 to 3 weeks you remove the outer covering, and then ano na siya, pwede mo nang skin graft.
Are there cases where you can also like get part of the skin and grow skin?
Actually, abroad, first world countries, they get a portion of your skin, they culture it, they grow skin to be used. Pero hindi rin instant yun. It takes several weeks before you can apply it to the patient.
Yeah, it's not gonna grow in one day. Like, oops, I have a whole, I have a layer. Thank you, doctor. Okay, for telling us about techniques in other countries, and I hope we get to that point now where we can also
hopefully.
Hopefully. Okay, so when people have burns and burn wounds, and of course you're treating them, and you're maybe doing reconstructive surgery, what are some of the complications that can arise during the treatment?
Okay, so number one complication, always infection. Okay, so after infection, common complications, hypertrophic scarring. This is when this happens in both grafted and ungrafted burn wounds. So kumakapal yung sugat. Okay, so what you can do for hypertrophic scarring, number one, you can apply yung mga compression garments. Okay, you can also apply silicone sheets or silicone gels, and then pwedeng steroid injections, and also pwedeng laser treatments. And then other complications, mga long-term complications of burn wounds. Some burn wounds, they can later on, what they call this, become malignant.
Okay. So there are things you look out for when it comes to complications with burn wounds. Of course, it's the first one is always infection. You don't want it to get while it's healing, or like right after it's healed. And then scarring, you're talking about scarring. When the scar is too thick, it's not ideal. And you mentioned some ways to take it out, to not to take it out, but to improve it. You can use compression, and of course this is all under your care and direction. I mean, we can't just go around and do it ourselves, because we don't know what we're doing unless we're specialists like you. And then of course you also mentioned laser can help with scarring, I guess, the really scars. Okay. And then you said that later on the wounds can become malignant. What exactly does that mean, doctor?
Some burn wounds, because of the chronic irritation, can transform into squamous cell carcinoma.
Okay.
But it takes a very long time for it to happen. Okay. And then another possible complication that I forgot to mention was burn contractures.
Oh, okay. What are burn contractures, doctor?
Okay, so whenever you have second, third degree burns, okay, it results in an open wound. And how
Mhm.
does an open wound heal? Open wounds, they heal by contraction, okay, to
Mhm.
close. So the body will contract to close the wound and repitalization. So contraction, it uses tension to close the wound. And
Okay.
tension is a known cause of scarring, hypertrophic scarring.
Mhm.
So pag sinabi mong burn contractures, sometimes when you develop scars over joints, pwedeng ma-restrict yung movement.
Mhm.
Okay,
Okay.
so sometimes you have to do reconstructive surgery to free the joint.
Okay.
Okay.
So let's take the example of the joint when we talk about just to recap burn contractures. Of course, as you said, there's an open wound. Now the body wants to
To
parang
close
put
that wound.
back together, di ba? Close that wound.
Oo.
So it contracts, meaning nag-iipit. It it comes back. So if it's I mean it wants to join it. So as you said, one of the possible complications of that is that it will put a bigger scar there. And when it
Yes,
comes to
a
a
thick
joint,
scar.
a thick scar, you might not be able to move it. So you have to treat that scarring also.
Yes.
All right, doctor. Um, what are some of the you already mentioned some of the latest advancements in reconstructive surgery. How do you stay up to date with these techniques? And how can we also stay up to date with techniques? Do we just look at are there certain let's say institutions that you would recommend, or like how would we read about it, and how do plastic surgeons like yourself and specialists stay up to date, and like are waiting for the technology to come here? I mean, what is the
Well,
I mean how
for
do you
plastic surgeons, in our society,
Mhm.
so we have yearly conferences
Mhm.
to keep updated. We also read journals of the latest burn treatments
Mhm.
available. Okay. So that's it. You just continually read, and then hopefully some of those technologies that's already abroad will someday make its way here.
Yeah. So okay, for the general public, they probably would not read up on it, if it's not something that concerns them directly. But for surgeons like yourself, you have conferences where you learn a lot, and you probably like go abroad, and you probably spend on that just to keep up to date
Up
and
to
know
date, yes.
what you could possibly bring here, or lobby for in terms of technology or equipment or anything like that. And you read journals, and so it's always something that you're working on. You're continuously studying it in
Yes.
order to help patients. I mean, thank you for that service. Aside from treating patients already, you're keeping your mind open and making such a big effort to to learn more, to learn the newest techniques, and maybe to apply them, and hopefully we can get that kind of technology here someday soon. Okay. How there are cases, doctor, are there cases where a patient can get permanently disabled by a burn despite all best efforts, no, and they'd have to deal with it long term, or they'd have to deal with burn treatment for life? Are there cases
Yes.
like that?
Yes, there are cases like that.
Can you like just give an example, like just very very simple example of why that would be? Like despite all best efforts, this burn has disabled them, and they'd have to continue getting treatment for life.
Okay. Number one, yung demographic ng Philippines, we have
Oh.
very few burn centers in the
Mhm.
Philippines. Okay, so here in Luzon, I think we have in Metro Manila we have 4 burn centers, and then there's one in Cabanatuan, and
Mhm.
then the other 2 burn centers are in Cebu and Davao.
Mhm.
So
Wow,
sometimes,
that's
yes,
a
very
very
few burn centers.
Mhm.
And then not all of our kababayans, they have access to this burn center. So most of the cases that's sometimes they don't get access to the burn units. That's those are the people that you see that really suffer from burns because they were not managed properly during the acute phase of their burns, and then they were not offered reconstruction
Mhm.
afterwards.
So it's possible. I mean, you mentioned joints before, like somebody might, because they were not able to go to a burn center and have it treated properly and like with a whole team and a holistic approach like you do in Makati Med, um or at these other burn centers, that maybe somebody got too much scarring on their elbow and then they can't move it anymore, and they would
Yes,
have to deal with that for, they can't move their arm or straighten it, properly anymore, and then they would have to deal with that for life.
yes.
And okay, that's sad. Are you like, are you active? Do you know a society that's active in asking for more burn centers? I mean, is that something you'd like to, just like put out there that
Ac-
for? Mhm.
Actually, our society, PAPRAS, my society, we are in the process of setting up more burn centers across the country.
Mhm. Okay, that's great. I mean, every time I learn something from the show, and it's a different specialty, of course. Doctors like yourself and societies, they really, you are in the process of putting up more burn centers, and it also like it's an effort not to get it done. Like you yourself will not necessarily be practicing in that burn center, but you're gathering people who can practice so that
Yes.
you're able to treat patients with the kind of injury that you are dedicated to treating. No, so thank you, doctor, for that service, and thank you to your society. You said the name is Papras, no? Okay, so doctor, uh, what what uh what advice would you give to you, what you have for people who have experienced a burn, or in terms of ongoing care and prevention for future burns? I mean, of course there's different types of burns, as we said, no? For the first degree burns, if there's scarring or whatever it is, like what would you like to say? I guess you would probably want to address the ones with serious burns more, because they suffer the most. You treat them probably the most. Yeah.
So probably for any person who gets burned, you seek consult. Okay, so because you never know if you might need admission, and you might need further treatment, skin grafting or reconstruction later on. And
Mhm.
then for those patients who were burned before but it's already healed, but with restrictions, okay,
Mhm.
because of their burn wounds, they can
Mhm.
still seek consult with us, okay,
Mhm.
and so that we can plan their reconstruction.
Mhm.
So we're here, so they just go to us, seek
Mhm.
consult, so we can help them.
Okay. Doctor, th- when you, of course, you said seek consult, no? If you're not sure about your burn, it's not just a scalding or it's bothering you, of course, go to a doctor. I mean, any doctor will do first, right? And then they can
Yes,
refer them to you.
refer to us. Yes,
Or go to the emergency room. They may not admit you, but at least somebody can look at it and then refer them to you and give them advice on how to deal with that. Now, of course, for those who are admitted or have more serious burns, you said, if they have restrictions because of their injuries. Can you tell us about some of the restrictions? What exactly it would be a restriction? Mhm.
for example, your hands get fused, so you can't use your hands properly. Okay, sometimes when your neck fuses with your chin, so you can talk properly, or you can't eat properly when your mouth is constricted. Okay, same with the major joints. Okay, if there's a restriction, you can't use it properly.
Mhm.
Okay, so we can
So
address those problems.
you can address those problems. You're there for people who need that, because okay, thank God they've recovered from the initial pain and initial infection or any kind of burns, but you can give them reconstructive surgery to restore function.
Yes, restore
Also,
that.
Mhm.
That's
Restore.
the goal of plastic surgery, to restore function.
Okay, so the goal of plastic surgery, as you know, everyone remember out there, is to restore function. I
Function.
mean, it's not just to beautify, but that's also important in terms of, as you said, if a patient, what's the goal of the patient? If it affects people so much, the way we look, what we're used to, and I would suppose that a burn victim would feel that they didn't choose to look this way. Something happened to them, or if they can't move their chin, you are there for them. Okay, so that would be your advice, is always to seek consult. Have you encountered people who do not seek consult because they're afraid of the cost?
Yes.
Okay, and what would you tell them? What would you say to them? I mean, like, how would you encourage them to still seek consult in certain burn centers, or how do you encourage them to, keep going?
In government hospitals, and with the advent of the universal health law, yeah. So
So that's your
access to burn reconstruction is more, what do you call this? More accessible to our kababayans. So they
okay.
just go to any government hospital, okay, and then they will be referred to us, because we have colleagues in government hospitals.
Mhm.
Okay, so just go for a consult.
Just go for consult. And for those who are worried about cost, I mean, as you said, go to the government hospital, go for a consult. Don't give up. They can
Yes,
be referred to you, or government hospitals. With the advent of the universal healthcare bill, a lot of people, a lot of expenses that you had to do out of pocket before are being covered now. Of course, it's,
yes.
lengthy process paperwork, but it's a case to case basis. And you just have to keep going. Doctor, we have some messages here. Lucas is watching from Hawaii. Hi to all my family in Manila. Okay, Lucas, I'm glad you're watching and that you've been learning a lot from Dr. Mike here. Christine is watching from Iloilo. Hello, Christine. My lolo is watching your show, Miss Nicole. Very informative. Okay, that's great. I mean, I'm glad that the doctor is able to reach out to you and give you this information. And then Luna is saying hi to all her family in Manila. Okay, so I guess thank you, guys from who are tuning in from abroad. I guess we have people watching, and at least they know that in Makati Med there are doctors like you, and there's you who can treat these things. Perhaps, I mean, maybe if they got burned abroad, I mean, they can come here and do the rest of
Yes.
their journey in completely healing with you and the team in Makati Med that treats burn victims. Okay, doctor, would you like to say hi to anyone, or just put any message out there, as we're wrapping up and running out of time, but I think you have such an important mission, you know.
And I just want to say good evening to all our viewers and listeners. So stay safe.
Stay safe. Okay. So, as a final word, I'd like to say I thank you very much, doctor, for being a guest on this
Thank
show.
you also.
I learned so much, and I'm very touched by people like you who go out and treat burn victims. I mean, it's not something we often think about if we don't know someone who has suffered from it. But at least now we're more informed, and even with small burns in the house, you've informed us on how we can better take care of ourselves, with the presence of mind and other things. We've talked about first degree burns, like simple or sunburn, simple burns, down to burns that we're been made aware of how some people get hurt with burns. And I hope this show serves as a reminder out there, not only to have presence of mind and take care and be careful when it comes to burns, but to also be aware that there are people who are suffering from this, and if there's anything you can do for them, or you want to help out the association of Dr. Abenohar here, or you want to start something, you want to help out, if it's something that's close to your heart that touches you, then do it. And to those who are burn victims and their families, keep going. I hope this show serves as something like a dedication to you, and to keep going, don't give up. And there are people who care, and people like Dr. 𝗶𝗶 and the burn unit in Makati Med, they definitely do care. Thank you for being on the show, Doctor.
Thank you.
Okay, so join us again next week on Healthline with Makati Med. Remember that we are live on radio, DZRJ 8:10 a.m. That's 810 a.m. We're also live on Radyo Bandido TV, and that's 224 on Sky Cable, and whatever other box you have or device you have, we are live there. And of course, sometimes our shows are shown also at other times. It depends on the programming. And we are also on Facebook, on YouTube. You can access us anytime. You can repeat the shows so that you can hear what Dr. 𝗶𝗶 said over and over again, to learn more, to be entertained, to be informed. And we hope that this show has helped you in some way to have a healthy and uplifting lifestyle. Thank you for being on the show, Doctor. Please come back. Talk more about plastic surgery. I'm sure it's not only reconstructive surgery that you do when it comes to burn victims, but other things as well. And we'd love to learn about that. Thank you for guesting today, and thank you for those who are viewing right now and who will view later on. And if you haven't hit the subscribe button on the Radyo Bandido YouTube channel, click it. It's free. Thanks, guys. Thank you, Doctor. Okay, bye everyone. See you next week on Healthline with Makati Med. I'm your host, Nicole Jacinto. It's been a pleasure. Take care.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.